this is probably not anything that any of us thought in our lifetimes that we would be facing. And so it is very scary to be dealing with this. And we're not quite sure what direction it will go in. We're hoping that all of the steps that we're taking right now, with social distancing, with really strong emphasis on hand hygiene and trying to reduce the possibility of transmitting infection to others in our homes and our community, and the restrictions that we're taking on the side of healthcare to try to protect our patients and our healthcare workers and keep in mind our limited resources. We're hoping that all of these steps, they're not meant to be just frightening people, but are really a preemptive plan in order to prevent what could potentially be a healthcare disaster, as has been experienced in some other countries before us. We're trying to learn the lessons that China and that Italy are learning right now, and Iran is learning right now, and we're trying to learn from them before the same thing happens in the United States. I'm sure a lot of people have heard about the idea of flattening the curve. If you look that up, you can even Google that term on the internet. Basically, when hospitals are taking care of kind of a usual number of patients, they use their resources in a really kind of predictable way. During flu season, we always anticipate an increase in number of people that will come to the hospital with respiratory illnesses, because with it, influenza can also bring an increased number of pneumonia, and people with chronic lung disease tend to come to the hospital more during flu season. But what's really different about this is that this virus is spreading very quickly, and it's spreading in a way that makes it difficult for us to get a handle on, because a lot of people think that they might have the flu or might not even be that sick, maybe just a minor cold, and think that, well, this probably isn't anything. I work through this, or I go to school with this all the time. And so they're continuing their usual kind of social interactions and perpetuating the spread. And like we said, in about 80% of people, that may be no big deal. You have a minor illness that you can suffer with at home, but it's the compromised patients, the people who are older, over age 60, the people with those chronic medical conditions that we talked about, that they will be coming to the hospital in large numbers. About 20% of people who are infected, like we said, will get severe or critically ill, and they will need those limited resources that we have in hospitals. So that really makes a high peak of patients coming in to access healthcare. And our hospitals, our healthcare system in the United States is really not built to be able to handle a large influx of patients at one time. So what we're trying to do, rather than having that peak of patients coming to the hospital and all demanding care at the same time, is to flatten it out so that as we slow the spread, hospitals have a better chance of being able to handle the increased volume of patients coming to need critical care or need hospitalized medicine, so that we can give them the care that they need and really not put ourselves in the position, like some other countries are having to do, of rationing care, rationing ventilators, because they just do not have the ability to take care of all of the patients who come and seek care. So flattening the curve is very important here. So all Americans, all people here, we have to feel like we're in this together,